And guys, in this video I'm going to be talking about acute sensorineural hearing loss. And in this video I'm just going to quickly go through all the go through it in 4 minutes. I'm going to explain such a big concept in just 4 minutes. So let's get the timer started. Is timer started? Perfect. Okay, next one. So what is going to be this? First of all, where's the location? Location being unilateral, meaning that it's only in one ear. It's not in 2 ears. It's in how many ears? It's only in one ear. What's going to be the length? The length is going to be a few hours to a few days. And what's going to be description? You can feel pressure. And here's a very good mnemonic you run: is full houses have TVs, meaning full as in fullness or pressure in the ear. Houses meaning hearing loss. T as in tinnitus, and V as in vertigo. The next thing is going to be causes. Causes can be determined are that sensorineural loss are very dangerous causes. So A as in autoimmune, we'll get into that in the next slide. V as in viruses, we'll get into that in the next slide. R as in a rupture of the cochlear membrane. So over here I've drawn the cochlea is a picture over here, source being this. And basically the cochlea can be divided into 3 categories: scalae vestibuli, scalae medii as in middle, and scalae tympani as in the tympanic part. And they have membranes. I'm not exactly sure of the membranes. These black, remember them as membranes. These each have fluid inside them. So any sort of rupture of these membranes can then lead to a big problem. And disorders in the microcirculation being that we have the basal artery, you have the ICA giving the branch, we can then give the labyrinth artery, it then branching out into common carotid, common cochlear and anterior vestibular artery. So any sort of thrombus in this can then lead to a big problem. So mumps herpes, we have a head trauma, ear operation, noise trauma, we have vascular hemorrhages such as leukemia, embolism, thrombosis of the labyrinth artery, which I drew over here, which is a branch of ICA. So the labyrinth artery is a branch of ICA, and then another artery being the cochlear artery is a branch of labyrinth, common cochlear, and then anterior vestibular artery. So that can be given a and so the ICA be the anterior inferior cerebellar artery. Ear disease is Meniere's disease. Cogan's disease is basically, remember, this is an autoimmune disease and it's attacking your ear. We have toxic drugs. We can learn this from LIC meaning loop diuretics. I being I do not know what I stands for, but I don't remember it being LIC. I remember it being LAC. So the L being obviously this, loop diuretics, A being amino. Excuse me, I don't know why it became amino glycosides, and then the C being lax. So the C, A also being analgesics, and then the C being cystoplatin. We have psychogenic, we have miscellaneous, meaning I think miscellaneous is different as multiple sclerosis, and as a neoplasia, meaning acoustic neuroma, metastasis to the cerebropontine angle. Remember that the cranial nerve number 8 is going to be very close here. Acoustic neuroma, again, remember it's going to be a schwannoma. It's going to be a vestibular schwannoma, so the tumor of the Schwann cells. Over here, guys, excuse this, we have how you're going to do this: audiometry. In audiometry, you're restricted to middle and higher middle frequencies. You're going to see the graph is going to look somewhat like a descending. So if I were to draw the graph, it would kind of be like this. As it would as the decibels and the frequencies would kind of increase, the graph would be declining. Vestibular tests, there are many vestibular tests, such as a rotating chair test. They can be also evoked potentials, myogenic potentials test. I kind of have a website over here. It's called mercy.com. It kind of covers it all, such as the electron nystagmography, video nystagmography, rotary chair test, computerized dynamic posturography, dynamic visual activity, and then the treatment. What's the treatment? Treatment is many. You want to get these dextrans, which are decreased viscosity, decreased thrombosis. You want to get vasodilators, corticosteroids. Make sure to give 40-60 for 1 week. Tape it off. Carbogen, so you get decreased amount of. Okay, the timer is running, but basically you want to get an increased amount of oxygen to kind of help with treatment, and also a carbogen, because it kind of allows it emits O2 binding to red blood cells, so more O2 to the tissues. So guys, I hope this was a really good way to kind of go through the sensorineural hearing loss. We've covered the topic. I'll just ask you guys some questions. Guys, can you tell me which drugs cause sensorineural hearing loss? So yeah, if you said that it's loop diuretics, analgesics, aminoglycosides, and cystoplatin, that's correct. Guys, can you tell me 3 treatments for sensorineural hearing loss? So yeah, guys, if you told me corticosteroids and you told me dextrans vasodilators, then you are completely correct. Yeah, so guys, thank you guys for watching this video. Hope to see you guys. I hope you guys like this video and hope to see you guys next time.